Hello everyone, Dr. Boyd. Welcome back to Parently. Today we're going to talk about iron deficiency anemia. This is a topic that is very important. 1 in 4 pregnant women will suffer from iron deficiency anemia. What does this mean and why does it occur? First to understand is iron deficiency anemia simply means that your hemoglobin in your blood that is important in carrying oxygen to your entire body, including your baby, is low. The normal hemoglobin in a healthy, non-pregnant woman is 12 to 15. When you become pregnant, you are growing blood for 2 sources. Number 1, for yourself. Remember, your blood volume is going to almost double during your pregnancy, so you need hemoglobin to increase that blood volume. Number 2, you're going to increase your hemoglobin needs because your baby is also growing its blood supply. So those 2 reasons often will cause women to suffer from anemia. So anything less than a hemoglobin of 12 is defined as iron deficiency anemia. What are some of the symptoms that you will feel when you have anemia? You will feel extremely fatigued. You probably will look pale. You will have shortness of breath. You may have decreased appetite. And you may crave things that are non-food items, especially if your hemoglobin is extremely low. For example, women will start eating large amounts of ice, or you will want to eat dirt or grass. I know it sounds crazy, but severe anemia can cause this type of problem. It's called Pica. Very uncommon that anemia will ever get that severe, but I've seen it several times in my career. After you've determined that you may be suffering from iron deficiency anemia, if you don't have routine blood work at your physician's office, I would encourage you to call them and tell them you're suffering from some of these symptoms that I described above. A simple blood test will determine if you have iron deficiency anemia. Remember, I mentioned that the hemoglobin should be 12 to 15, and if you're falling much lower than that, you have anemia. So you'll simply go to your physician's office, get your blood drawn, and they will notify you whether you have anemia or not. We're going to assume, based on this lecture, that you have iron deficiency anemia. What are some of the things that you can do from a natural standpoint and with medication? First thing your physician will do is they will order iron tablets to be replaced. You'll take those 1 to 3 times a day, every day. They can cause nausea and vomiting. They can also cause severe constipation. So oftentimes women will want to take natural substances either in their diet or other elements of iron replacement so that they don't have the severe problems that iron tablets can create. What are some of those things that you can do? Number 1 is to increase your intake of red meat. Red meat every day, 1 or 2 times, has 2 to 4 milligrams of iron in that particular piece of meat. Poultry, fish, have iron as well. If you move to the leafy vegetables, spinach and kale, beets, I know a lot of people don't like beets, but they have a large amount of hemoglobin in them. Beans have a large amount of hemoglobin. Lastly, and I know you'll like this one, is cocoa, specifically dark chocolate. In fact, 7 ounces of dark chocolate has more iron in it than 3 ounces of red meat. Now, I'm not saying pig out on dark chocolate, but it's another nice replacement to increase your hemoglobin. Obviously, I encourage you to replace the iron as your healthcare provider dictates, 1 to 3 times per day. Oftentimes, they'll have you come back to the office in 2 to 4 weeks to recheck your hemoglobin to see if you're improving. Now, if you continue to have severe iron deficiency anemia, let's assume in our example that your hemoglobin is less than 8. We don't want you to head into surgery or a complicated delivery with a low hemoglobin. So one of the things that you can do if you have severe anemia is either a blood transfusion or iron infusion. Every healthcare provider has a different take on whether they want you to have a blood transfusion or an iron infusion. Iron infusions are safer than a blood transfusion, and that is more and more common as we move forward in our management of pregnant patients. Iron infusions are simply an IV form of iron. You come into the hospital and it takes approximately an hour to infuse the iron. They'll do subsequent and follow-up hemoglobins on you to make sure that your iron stores and your hemoglobin are improving. Complicated subject, very important because 1 in 4 women suffer from iron deficiency anemia. I encourage you to talk to your healthcare provider if you have further questions about whether this affects you and what you can do moving forward. Hope this video was helpful. This is important information that you can feel comfortable in managing and directing your own iron deficiency anemia. Have a great day.